Hey everybody! I brought you guys into the other room. They're getting set up in there. Hey Nancy, how are you? Hey Caitlin. Hey, so we're gonna get started here in just a couple of minutes. And here actually, this is my husband, Dr. Andrew. He's gonna be presenting for you guys this evening. And we're gonna get started in just a couple minutes. I'm just gonna go over a few things. We have a couple more. So I am here. My name is Nicole Dodge. My husband and I own Valley Family Wellness and Chiropractic in Stanton, Virginia. And we have here at our office a live class that's going to go on tonight. We have folks from our community here. It's a pretty packed room. So what we are going to do is go through this genetics and your health presentation. Dr. Andrew is going to be sure to pay close attention to the questions that are being asked live and be sure to address those first. If you guys do have questions as we're going through this tonight, feel free to type them out on the screen. Oh, yes. Okay, that's great that you can't stay. It's totally fine. We'll see you soon, Nancy. It'll be on live for 24 hours. So if you want to ask questions during the presentation, feel free. I'm going to have a pen and a piece of paper, and I'm going to kind of take notes during the presentation of questions that you guys have so that we can kind of address them in a timely manner at the end, unless there's something that pops up that just needs clarification at the time. So we are going to get started there. This will be live on Periscope for you guys tonight for 24 hours after the replay. So it is available for you there. And he's going to give you contact information at the end as well, should you have additional questions. So thank you guys for the hearts. If you are listening to things that you love, definitely let us know. We hope that this is information that is new to a lot of you. I'm really biased because he's my husband, but Dr. Andrew is a smart guy. He blows me away every time he does a presentation, so I think you guys are really going to enjoy it as well. The pictures that I was showing you at the beginning of the Periscope tonight were of my son, Luke. Andrew and I have two kids, Luke and Josie, and we actually used a lot of genetics analysis last year to help Luke, whose pediatrician was about ready to send him off to pediatric GI doctor for exploratory surgery. And Andrew will talk to you guys about that here shortly. But without further ado, I think we are gonna go ahead and get started.
Y'all see that on the super bright on this computer thing, so you can't really see the slides. Good. Yeah. Okay. Cool. We're gonna go ahead and get started. If you can't hear me on the Periscope thing, just type whatever. I don't know how Periscope works. That's why my wife's doing it. So my name is Dr. Andrew Dodge. Thank y'all for showing up. Most of y'all here know me. So for those of you on Periscope, I'm a chiropractic neurologist here in Stanton, and what that means is I've taken over 500 hours of functional neurology training and taken fun tests and stuff to get certified in neurology. I have over 200 hours of pediatric and prenatal training. I'm Webster Technique certified through the International Chiropractic Pediatric Association. So we see a lot of kids and families and stuff in the office, and I've taken, I don't know, 300 or 400 hours of functional nutrition training through Functional Medicine University, Seeking Health Educational Institute, Apex Energetics, and the Institute for Methylation and Bioindividualized Medicine. So we do a lot of functional nutrition stuff, functional medicine stuff here in the office. So we kind of have two subsets of patients here, the kids and the families, and the more chronic illness type patients. And we try to approach each of their cases in a similar way, looking at lifestyle and dietary changes and adding in supplements and essential oils instead of medications and stuff like that, and see if we can get people transitioned onto that instead of medications. So this talk tonight, we're going to talk about genetics, because that's part of what I do. I look at people's genetics and see how they play a role in people's health, and different things we can do with specific forms of supplements to either bypass certain genetic mutations or enhance function of certain enzymes and things like that in their health. So we're talking about specifically MTHFR, or methylene tetrahydrofolate reductase, the gene and the enzyme of the same name tonight. But this picture here, if y'all can see that on Periscope, it looks pretty complex. This is from Seeking Health. This shows your folate cycle, your methylation cycle, CBS cycle here, neurotransmitters over here, and each of these circles, little circles in this bigger complex pattern here, are enzymes. All those little letters are cofactors and vitamins, and the words and stuff in there are substrates. So it gets really, really complex. So we're going to try to keep it really, really simple tonight so that we start everyone out on the same page and everybody understands the basis behind MTHFR and methylation. Because right now I see a lot of blank faces and they say, what's methylation? And they have no idea. So we're going to start out with the basic methylation stuff. So the disclaimer, this is an informational lecture only. The information given in this lecture should not be taken as medical advice. Consult your physician before starting any supplement or essential oil therapies. Any questions regarding specific personal health concerns will not be answered during this lecture. I can't answer specific health questions, even if you are a patient during this lecture. So either schedule time with me afterwards, or if you're on Periscope and can't get into Stanton, I do phone consults and stuff like that. So here we go. Topics we'll cover tonight. We'll talk about methylation, what it is, what it means. MTHFR, we'll talk about why that enzyme and the gene is so important in health, and different factors that affect that, and what if that enzyme doesn't function correctly, and what you do. So we'll talk about other factors that contribute to your health from a genetic standpoint. So not all genetics are centered around MTHFR. Not all health problems are centered around that MTHFR enzyme. Even though a lot of people like to throw a lot of emphasis on it, it's very important, but there's a lot of other things that contribute to the function of MTHFR and overall health in general. So we'll talk about the other factors. And then what do you do leaving here? What can you do to investigate your own health, and steps to take towards better health? Cool. So methylation. Methylation starts with a methyl group. What is a methyl group? A methyl group, if you think all the way back to high school chemistry, is a carbon and 3 hydrogens. So a carbon atom has 4 electrons it likes to donate, and this methyl group is 3 of those electrons are taken by hydrogen. It has 1 electron that it can bind to different substrates. So methylation is the process of donating a methyl group, this carbon and 3 hydrogen, to a substrate. What's a substrate? Anything. Chemicals, vitamins, DNA, RNA, hormones, neurotransmitters, nerve cells, immune cells, anything in the body can be a substrate. So chemicals, if you want to attach a methyl group to it, you need to attach a methyl group to chemicals to help detoxify them. If you want to methylate vitamins, to change the form of the vitamin, like folate to methylated folate, which we'll talk about. DNA and RNA, DNA either turning on or off certain genetic codes is very important. Typically, methylation of DNA turns off the transcription of genes, so that's important in cancer cells and things like that, where we want to turn off the production of certain proteins. RNA is uracil is an RNA base, and methyl uracil is thymine, a DNA base. So it's DNA based synthesis from the RNA base. So you need methylation to do that. Hormones, you need to methylate your hormones to detoxify them, specifically estrogen. Estrogen dominance is a huge issue these days, so a lot of people can't form those methyl groups efficiently, and they can't detoxify their estrogen, and so that becomes a major problem. Neurotransmitters, we'll talk about this later. I think Nicole mentioned it on the Periscope thing. We have a personal story about the neurotransmitters and methylating neurotransmitters to detoxify them. We'll talk about that later. Nerve cells, you need to methylate the nerve cell to myelinate the nerve cell, so to create that fatty layer of the nerves around the nerve cell to allow the signaling to go faster along that nerve. And then the immune cells, turning on your natural killer cells, you need methylation. So if you can't turn on your natural killer cells, you'll increase your cancer risks, because natural killer cells kill cancer, right? So how do we create those methyl groups? How do we form those methyl groups so that we can do all of those functions right here, right? So how do we do that? It starts with B9 and the methylation of B9. So attaching a methyl group to B9. So that's where your MTHFR enzyme comes in. So MTHFR gene is on the first chromosome. It's on the short arms of the first chromosome. It's got over 20,000 base pairs, and what the research, or the current research shows, is that there are 2 mutations at 2 different locations at the spot 677 and 1298. Those are 2 locations on that long band of base pairs that get mutated, and that mutation can change the function of the enzyme. So base pairs on the genetic code for amino acids. Amino acids are the base building blocks of proteins. So the code sequences those amino acids, so it puts them together and forms a protein overall. If you have mutations in that genetic code, you may switch out certain amino acids for different amino acids. If that happens, it changes the shape and the way that the enzyme folds, or the protein folds, and so the function of that enzyme or the function of that protein can change. Just because you have a mutation, though, this is important, listen Periscope, just because you have a mutation in a particular genetic code for an enzyme doesn't mean that you're necessarily going to have decreased or increased function of that enzyme, though. But just because you don't have mutation along that coding doesn't mean that enzyme is going to function perfectly. So there are other contributing factors to how that enzyme and that protein functions, whether it's cofactors or inflammation levels or any number of things, right? So if you get mutations, typically the 677 mutation is a little bit more severe than the 1298 from different researchers and what they've found. We'll talk about that in a little bit. When you have an enzyme, any enzyme, you need a couple of things. You need cofactors to actually activate the enzyme to make it work, and you need the substrate. So the thing that's turning, that the enzyme is turning into a different thing, right? So if you have vitamin deficiency or mineral deficiency in your body, you may have decreased enzymatic function because you have lack of cofactors for the enzyme. There are a number of different things that can change the amount of methylation that you have in your body, specifically medication, whether you're taking antacids can decrease methylation, or you have birth control that can decrease methylation. There's a whole long list of medications that can decrease this function of changing B9 and giving it a methyl group. So lack of cofactors can be something that decreases the enzymatic function. And then you can have excess vitamins. Things like niacin will deplete methyl groups. So people doing high-dose niacin therapy for their heart health and cholesterol may not be doing themselves any services because they're actually decreasing the amount of methyl groups they can actually make, right? So then you look at mutation. You have a heterozygous versus homozygous mutation, meaning one copy of the mutation versus 2 copies of the mutation. It changes the function of the enzyme. So typically, what some of the research shows is that heterozygous, or one copy of the mutation, you have about 70% function in that enzyme, which is still pretty good. If you have a homozygous mutation, or two mutations with that enzyme, then you'll have anywhere from 30 to 50%, depending on your different situations of function in that enzyme. So homozygous mutations, typically more severe. You got to do a little bit more to combat that. But again, there are a lot of factors that can contribute to that. So now that we've talked about enzymes in general, we'll talk about MTHFR enzymes specifically. So this is the folate cycle. If we go back to the first slide here, that's right here. We're looking at this specifically. So It all starts out with B9. So you have B9 in different forms. So one of the forms of B9 is a synthetic B9 called folic acid. If you know me or talk to me at all about forms of vitamins, you know that I hate folic acid. Folic acid is synthetic, meaning that it's only produced in a lab. It's not really found in nature. But it's super shelf stable, and it's cheap to make. And you can put it in any vitamin, so that's what a lot of supplement companies do. So folic acid, why it's so bad, your body has an enzyme to metabolize it. However, you get left with a bunch of unmetabolized folic acid because it's not a natural thing to be occurring in the body, right? So unmetabolized folic acid can actually block the further metabolism of folic acid itself, which is kind of silly. And it can also block the further metabolism of your folate that you get from your green leafy vegetables. So if you're eating a lot of salads and getting a lot of green leafy vegetables and getting a lot of folate that way, but you're taking a B vitamin that has folic acid in it, you're blocking the absorption and the utilization of that folate. So something to consider is getting off of the folic acid so you can actually metabolize the folates that you're getting in your diet, right? So other things that unmetabolized folic acid can do is create more inflammation in the body, block folate receptors like on the brain, and it can lead to folate deficiencies in the brain. So any neurological issue that you have going on in your brain may be a folate deficiency actually in your brain cells, because on the blood-brain barrier it's being blocked by folic acid, right? So it can also decrease immune function, leading to increased risk of cancer, specifically estrogenic cancers and colorectal cancers. So get off of the folic acid as soon as you can. So if you have supplements that have folic acid in them, throw them out, get a different form. If you're eating foods that are fortified with folic acid, I really don't recommend that either. So green leafy vegetables, pretty awesome. Good stuff, you need that. When you get your green leafy vegetables, it's called dihydrofolate, is the form of folate. It gets metabolized through some enzymes, which you don't really need to know, so you don't need to write them down. And then it gets to this form of folate called 5,10-methylene tetrahydrofolate. You don't need to know that. But that's where it hits your MTHFR enzyme, your methylene tetrahydrofolate reductase. So it takes this and reduces it down to L5-methyl tetrahydrofolate, which is your methylated B9. So this whole process takes folate and puts a methyl group on it. Basically it. So you don't need to know all this. This is kind of complex. If you get more into it, you can research all this stuff. But you take folate from your leafy greens or your supplement with folate in it or anything like that. You metabolize it down through your MTHFR enzyme and it creates a methyl B9. So that's really important, and that's really where methylation all starts. You take that methyl group and that comes up. This MTR enzyme is going to be on the next slide. Well, it won't be on the next slide, but this deals with B12, which will be on the next slide. So that's kind of where things fit in. So we go back to our big thing here, and we covered this right here. So MTHFR goes up here, creates your methyl B9, and then we get into B12, which is up here. Okay? Everyone hanging with me? How we doing, Periscope? You doing awesome? Sweet, me too. Okay, so you get your methylfolate right here, right? Like I said, and it comes up and connects with B12, typically methyl B12 here, and so that takes homocysteine, one of your body's most inflammatory proteins. Our creator's awesome. So, side note, homocysteine is our body's most inflammatory protein, and it gets turned into, through the CBS pathway down here, it gets turned into glutathione, our body's most powerful antioxidant, or it can be turned into our body's most powerful methyl donor, SAMe, in this cycle right here. So our most inflammatory protein creates proper DNA expression, proper enzymatic expression, and amazing antioxidants. So how awesome is that, right? So you get your methyl B9, methyl B12, homocysteine turns into methionine, attaches to some energy, and turns into SAMe. SAMe, a lot of people have heard of it. It's your main methyl donor for your body. So the methyl group sits on SAMe, and it's just hanging out, and it waits for a substrate, X, right here. See the X? X is the substrate. X gets methylated into methyl X. X is the substrate, right? And it does that through a methyl transferase. You don't need to know that. But this is the whole process of creating the methyl donor right here, SAMe. That's the ultimate goal, is to create SAMe from your methyl B9, right? So that's the whole process. But MTHFR is right here. It's over here. You can still have problems here. You can still have problems over here. You can have problems down here. You can have problems over here. So there's a lot that contributes to the whole methylation cycle other than just the MTHFR enzyme, right? So it's important, absolutely, because if you can't create your methyl B9 here, then the whole process doesn't even start. So it's really important, but it's not the only thing. So what happens if that whole process doesn't start? What happens if we don't methylate, we don't create SAMe to donate methyl groups to other substrates in the body? Well, we have issues with a lot of functions in the body. I've already mentioned some of these. So starting out, we have these mutations at spot 1298 on the gene, right? And adenine is switched to a cytosine. That's what that means. So if you see this A1298C, it means the adenine at spot 1298 is switched to a cytosine, right? And at spot 677, a cytosine is switched to a thymine, right? So that's all that means. Typically, the 1298Cs are not as severe as the C677T. From some of the research that Dr. Ben Lynch does, he notes that the heterozygous mutations there don't really cause that much of a problem, typically. And it's only an issue when you have compound heterozygous mutation at your 1298 and your 677, or you have a homozygous mutation at 1298. So when we see 677 by itself, that's typically more severe than just a heterozygous 1298. But if you have compound issues, that can create more of a problem. So what issues do we see? During pregnancy, we need to turn on and off our genes appropriately and at the right time. So if we don't turn off some of the genes and some of the protein transcription, then we run into other issues, different tumors and things like that. DNA and RNA synthesis, like I mentioned, the uracil methylating to thymine. So if we don't have enough thymine, we replace it with whatever we do have, right? So you can get substitutions in a lot of these enzymes, in a lot of these base pairs, if we're not creating our DNA and RNA appropriately. So the main cause for miscarriages is going to be DNA mutations that are not compatible with life. So that all comes back to appropriate methylation and creation of the base pairs. So that's really important. Another issue with pregnancy that we see is going to be the clotting factors. So if we look at some of the reports that get printed out and they have clotting factors on there and some of the mutations are in there, you look for symptoms of excess clotting or really fast clotting. MTHFR mutations aggravate those typically. So if that's not functioning right, if we're not methylating correctly, the clotting factors become an issue during pregnancy, during labor, postpartum, and things like that that can turn into issues. Immune cells, like I mentioned, a maturation of T cells and activation of your natural killer cells. So this is, if your natural killer cells don't work, natural killer cells kill cancer, and you get increased cancer cells and stuff like that. So that's not good. Energy production through your mitochondria, hormones. I mentioned estrogens, neurotransmitter function. I mentioned detoxification. We'll talk about that in a minute. Myelination, brain function, detoxification. What he said earlier. Antioxidants, glutathione production, things like that, and gut health. So pretty much anything, right? You look at anything and you're like, oh my gosh. Well, it could be anything, right? It has so many functions in the body, transferring that methyl group over, that pretty much anything can be related to dysfunction of the methyl groups, right? So if that MTHFR enzyme isn't functioning correctly, you can get a whole host of different problems, from diabetes to Alzheimer's to Parkinson's, MS, miscarriages, PCOS, endometriosis, a whole host of different things, right? So it's really important to know if you're methylating correctly and know if you have some of these mutations, to where if you start showing symptomatology of certain illnesses that are low methylation illnesses and stuff like that, that we do something about it, right? So other factors, like I said, there's a lot of other factors that contribute to poor methylation or altered methylation or altered enzymatic function in general. And so as you delve deeper into genetics and get past the MTHFR gene and the MTHFR enzyme, you start finding these different enzymes that may be causing an issue as well. So if you look at your genetic reports and you see some of these things, you need to be aware that these can be issues as well, and it's not just, oh my gosh, I have MTHFR, that's it, that's the end all be all, I'm gonna die. You probably won't die. But you can have some of these other mutations that can make it worse, right? CBS mutation, like I mentioned back here, right here is where the CBS enzyme is, turns homocysteine into cystathione and cysteine and glutathione, right? So you can have issues there. B6 is an important cofactor for that. So if you're B6 deficient, which is pretty common, B6 deficiency can lead to dysfunction of that enzyme. COMT, this helps to detoxify dopamine, helps to detoxify estrogen, and other neurotransmitters. So this is where my story comes in with COMT enzyme. So my son, probably almost a year ago, a year and a couple months, I guess, right around Thanksgiving, he got sick. He got a virus or a bacteria or something, and so he got sick. He threw up once. He felt crummy the next day. He was okay. He got over it and went on about everything. And it was about a week later that he just randomly threw up at night. And I'm like, huh, that's weird. Okay, well, it's probably just something left over. He probably just didn't get over it, whatever. Next day, threw up again, randomly at night. One time, you know, one episode, a couple times, and like, wow, this is kind of weird. Okay. And he started getting really emotional, like laying on the floor, just so depressed, all he could do was cry, to standing up and hitting you and kicking you in a rage. And he got crazy, like digestive stuff, to where he was having diarrhea a lot of the time. He was starting to have like issues where he wouldn't eat in the afternoon, but he'd be like so ravenously hungry in the morning, he would just devour anything we stuck in front of him, and then he would stop eating around lunchtime and not eat the rest of the day. And then he'd have night terrors. I think I mentioned that, night terrors. He started just screaming at night and like talking in his sleep, like really frightened in his sleep, and he would just wake up and not know where he was and things like that. So had us worried. So we were like, this is really weird, this is not good. So we did some testing, and you know, gut tests and like stool analysis and some blood tests, and everything came back perfect. Like I look at blood work in very narrow ranges and functional ranges, and everything came back exactly where it should be in those functional ranges. There was nothing wrong, and we're like, okay, we have no idea what's going on. So about a month later, after he's been throwing up once a day for a month almost, he'd have a couple days in between where we're like, oh my gosh, he's getting better, he didn't throw up today. But then the next day it'd be worse and things like that. So finally took off the dad hat and put the emotion aside at like 4 o'clock on a Friday morning after I'd been up all night. And I was like, okay, what's going on? I connected all, you know, okay. So high dopamine leads to the ravenously hungry. It can overload in dopamine can lead to diarrhea. It can lead to the night terrors. It can lead to the crazy bipolar, like where he was just super sad and then crazy ragey and stuff like that. And so I was like, oh, okay, so let's look at his genetic. We'd run his genetic profile a couple months earlier. I said, let's go back, look at that. Sure enough, he's got like every mutation in the COMT enzyme that you can have. So, okay, well that makes sense. His COMT enzyme isn't functioning correctly. So what does COMT enzyme need to function correctly? It needs magnesium as a cofactor, and it needs vitamin C and SAM-E. So we gave him a little bit of B vitamins to help him make SAM-E. We gave him some magnesium, we gave him some vitamin C. And we took the catecholamines out of his diet. We took some eggs out, we took almond butter out, and bananas are a huge one that sets him off. That's high in catecholamines. And he was having all that food in the morning. He'd have eggs and some almond butter and a full banana. Sometimes he would have 2 bananas. And so we were like, oh my gosh, this kid loves bananas. So we took those foods out of his diet, fed him a couple of different things, gave him some supplements, and that night he didn't throw up. And we're like, huh, cool. Well, maybe it worked. Cool. Next day, he had a terribly emotional day. He was just like, it was like detoxing emotions almost. So he was crazy, up and down, all over the place. We're like, well, that didn't work. But that night he didn't throw up. So we just kept doing it. And the next day he was perfect. Back to normal, no bad poop, and no, whatever, and no crazy emotional stuff. And he didn't have any night terrors, and he didn't throw up. And we're like, hey, we're on to something here. This is awesome. So we kept doing the supplements, loading them up on some magnesium and vitamin C. We cut back on some of the B vitamins because COMT mutations can lead to methyl sensitivity. So we cut back on some of the B vitamins and started slowly adding in some of the foods. So now if he has a full banana, he gets kind of crazy, but he can eat a half a banana and still be okay. He can eat almond butter, pretty much as he wants, and he can have eggs again. So it's totally fine. So it was an illness that led to magnesium deficiency, possibly vitamin C deficiency is why he got sick in the first place, and the low magnesium caused the COMT enzyme not to function. So he's got mutations in that enzyme, so it doesn't function that well anyway. And then his illness led to magnesium deficiency, so now that enzyme doesn't work at all. So now he has crazy high dopamine. So he's crazy bipolar schizophrenic with digestive issues. So awesome.
And he's 4.
And yeah,
or he's 3.
He was 3 at the time. We were like, everyone's like, oh, he's just a normal 3-year-old. I was like, no, he's literally insane. But all it was magnesium deficiency with a little bit of mutation in that enzyme. So the magnesium deficiency led to symptoms of the mutation. So we upped his magnesium, and he doesn't have any symptoms of that anymore. So it can be something as simple as a deficiency that can lead to expression of the mutations, right? So, okay, back to business. MTR, this deals with B12, and it's cycling through cobalamin and methylcobalamin. It's zinc dependent. So if you're zinc deficient, a lot of your methylation stuff is not going to work. BHMT is zinc dependent. So if you don't have any zinc, you can't make B12, or you can't cycle B12, and you can't use your BHMT enzyme. Where's BHMT? It is, okay, so this is your folate. This is your B12 that we talked about. You're cycling between cobalamin and methylcobalamin. And right here, this bypass pathway is your BHMT pathway. So homocysteine to methionine without your methyl donors here, it's a bypass. So it needs zinc and phosphatidylcholine and some TMG. If you have a COMT mutation, trimethylglycine is not going to do really well with COMT mutations. So that's pretty complex. So you don't need to write that down. MAO detoxes serotonin. MAO-A detoxes serotonin. MAO-B detoxes dopamine, and that's the toxic detoxification of dopamine. So this is a contributing factor to Parkinson's, and if you have mutation of that enzyme, it's exaggeration of that enzymatic function, so it funnels dopamine down that toxic pathway. If you get toxic detoxification of dopamine, it can aggravate Parkinson's type symptoms and stuff like that. DAO, it metabolizes histamines. It's one of the ways you detoxify histamines. It's copper dependent, so if you're copper deficient, you need that. Most people are copper toxic, so that's typically not an issue. GAD, your GAD enzyme, takes glutamate, which is an excitatory neurotransmitter, and turns it into GABA, which is your inhibitory neurotransmitter. So this is people who are really sensitive to MSG or artificial sweeteners and things like that. Have that enzymatic mutation. People who are magnesium deficient typically are on edge all the time because they can't make their GABA, so they're really anxious, and they can't make their GABA to calm themselves down. So a lot of diabetics have that mutation as well. I'm diabetic, I have that mutation. FUT2 deals with gut function and probiotics formation, things like that. So that's important with your gut. SOD is important. It's a superoxide dismutase that deals with free radicals in your cells. And so if you have free radicals in your cells, that creates inflammation. Inflammation is toxic to your body and can cause all of these other enzymes not to function correctly. So anything that causes inflammation is going to aggravate all of these mutations. So this can also make you super sensitive to fluoroquinolone antibiotics. Fluoroquinolone antibiotics, you should never do fluoroquinolone antibiotics ever, realistically. So if you can avoid that at all costs, that would be awesome, because that can cause things like permanent neuropathies and stuff like that. So not really good to be taking, especially if you have SOD mutations. There are a couple other mutations that make you more sensitive to fluoroquinolones. It's just it's a class of antibiotics, but that's one of the mutations. It also will make you more sensitive to fish oil. So people who take high-dose fish oil and start getting like headaches and stuff like that may have this mutation to where they don't handle high-dose fish oil that well for whatever reason with that mutation. NOS, nitric oxide synthase, again, deals with free radicals in the cells, is important for heart health. Arginine is something that's good to help that. NOS gets depleted with more ammonia in your system. So if you're creating more ammonia for whatever reason, that's an issue. PEMT, I haven't seen a person who's been sick yet that doesn't have that. So it's a really common one, I suspect, just from what I've seen. Every genetic profile I've seen has a mutation here, either heterozygous or homozygous. This helps you create phosphatidylcholine, which is important for your BHMT and methylation. Phosphatidylcholine is something that I use on a lot of my patients, and something that helps them think clearly. I have a lot of patients that come back and say, oh my gosh, my brain turned on. How'd you do that? It's because the choline, created acetylcholine in your brain, helps memory, helps relaxation, that kind of stuff. So all those genetic issues aside, we need to take a larger view of health. Just because you have those genetic mutations, again, doesn't mean that you're going to have 70,000 problems wrong with you because you have 70,000 mutations and you can't take that many supplements, so you're just in trouble, right? So nutrition, basic nutrition. You should not be having more carbs than fats and protein, right? So eating more of a ketogenic diet, more fats and proteins and vegetables, cooked and uncooked, is important than having more carbs, a carb-based diet. So that's going to lead more to inflammation and things like that. So more of a ketogenic diet, low in sodas and diet sodas and fast food and things like that. You know, we do that every once in a while, and it's fine. It doesn't affect us a ton typically, but overall, you need better nutrition just from a day-to-day standpoint. So, nutrition. If your nutrition's not good, that's where I start. We start talking about your diet, and we start talking about gut health, and you need to fix all that before we start giving you supplements to support your genetic mutations. So if your nutrition is crummy and then you're just taking supplements to fix your genetic mutations, then it's not really going to work, and you're going to feel okay for a couple weeks, but then you're just going to crash right afterwards. So nutrition is super important. De-stressing. Every illness ever is created by stress. So if you have a super stressful job, try to find another one. I mean, this could be huge. Like, it could be a huge lifestyle change for you, but if you have super stressful job and you go to it every single day and you work way too hard and you're super upset all day long, it's killing you. So you got to find something else. So de-stressing is really important. So I've taken a lot of time off in the office. I've cut back on my hours a lot, spending more time with the kids, more time working out, and spending time by myself. So you know, it's really important to help de-stress so I can be better prepared to see my patients, so I'm not dragging all the time, right? So stress, super important to de-stress. Whatever you need to do, exercise, journaling is awesome. Take a couple minutes before you go to sleep and write your thoughts down on a piece of paper. You know, stimulates more left brain function, calms you down, gets your stress away. You can crumple it up and throw it in the trash can or shred it or whatever you want to do. Sleep, you need to sleep in bed by 10 o'clock at the latest, right? We struggle with this all the time because we don't really get the kids to bed until like 9 o'clock. So to be in bed an hour later is kind of frustrating when I have a lot of work to do. So sleep is a battle every night when you have kids, right? So, but it's really important to get sleep before 10 o'clock. It's really important with insulin regulation, insulin growth factors, hormones, and just helping your body to recover because you're waking up probably 5 to 7 o'clock in the morning, right? So you want to get 7 to 9 hours of sleep. 9 hours would be optimal, but you need to sleep, and you need to sleep all the way through the night. You can't be waking up 6 and 7 times a night. You need to be actually sleeping when you're sleeping. So if you can't sleep, we need to find out why, and we need to try to fix that, right? Detoxification is immensely important. We have so many toxins around us in our environment, in our food, in our water, in the air, everything we touch. We're drinking out of plastic water bottles. We have so many toxins in our system that it overwhelms the system. So why we start showing symptoms of these genetic mutations later in life and not when we're kids, it's because our toxic load is so much heavier as we age, and we can't detoxify as much, right? So detoxing, anything you can do to detox, essential oil use, or using a detox foot bath, ionic foot bath, or Epsom salt baths. You can use infrared saunas are great. Coffee enemas, even though they sound crazy weird, can detox you a lot. So those are awesome. Everyone that I know who has done one of those has raved about them and said how great they feel after them. So, even though it sounds super weird, try it. You may feel awesome afterwards. So, Young Living essential oils. We use Young Living. A lot of people here know about Young Living. A lot of people on Periscope know about Young Living. We use that because of the Seed to Seal promise. Because the owner of the company only talks about the product and knows nothing about the company. So that's awesome. And he just talks about his distilleries and how he, goes up in different places and farms and does all this other stuff. So he's way into his product and not the company. I mean, he knows how the company works, but he's only into his products. He's, if somebody asks how his company works, he's like, I don't care about that. I want to talk about the products up here and how they work and why they work and why I put them together, and they're awesome. So we know that Young Living oils work every single time. They have the best distillation process, the best pressing processes, and so we know it's in the plant, gets in the bottle, and is the same every single time. So, and they work every single time. So finding oils that work for you in whatever situation that you have, to support whatever system that you want to support is really important. So talk to your practitioners or look up reference material on what oils are best for you. Typically with the oils, they're going to have things like sesquiterpenes, monoterpenes that chemically work at the cellular level to increase your health. So looking up the chemistry behind the essential oils to see how they affect your health is awesome. And so I'm a super nerd, and I read books about that. So, and then genetics. Then we look at genetics. All this stuff we need to get right, and then we have the genetics kind of in the background. So we say, oh yeah, your diet, you probably shouldn't have, as many fish because maybe you're, toxin in mercury, or you can't deal with the fish oil as much, and you shouldn't have as many, or whatever. Something in your diet may be a little bit off. You shouldn't have 12 bananas a day because you have a COMT mutation or whatever. So we can change simple things like that in your diet and get more specific with your supplementation once all this stuff is taken care of. But if you're messing with, hey, I don't sleep, I'm super stressed, and my nutrition is junk, and I do nothing to detox, but I really want help with my genetics, I say, great, we need to work on all this stuff first. And then your genetics will improve themselves, and then we can work on the one or two things that aren't correcting without supplements and things like that. So what do we do now? After we look at the big picture, we look at testing. So you do your 23andMe tests. Has everyone heard of that? Maybe? I don't know. So 23andMe, go to 23andme.com. You don't get paid by any of the people or companies that I'm talking about today. This is just what I use in the office, and so that's what I put up on the board. So 23andme.com, they have a little tube, and you spit in a little tube, and they send back an email saying, hey, we have your genealogical information ready. And you're like, great, I don't care where I'm from, I want my genetic code. Mm-hmm. They have the raw genetic data up in the corner somewhere, you gotta go look for it. But they have your raw genetic data. I can't do anything with your raw genetic data, or I'll be here, all year looking at your raw genetic data. So you run it through apps. Sterling's app at MTHFR support is probably the biggest bang for your buck. It's a really good app. LiveWello is also really good. They have other sites like Genetic Genie, which is free. They ask for donations, but it doesn't give you as much as the LiveWello app or the Sterling's app. Things like NutriHacker gives you more information about certain mutations, but then it has conflicting information on what supplements to take and what foods to eat next to it. So if you don't really know how everything fits together, it may be a little bit confusing. So there's other sites and stuff that you can look at. So look at the big picture with the genetics in the background. So we want to get good baseline nutrition with our minerals, our magnesium, phosphatidylcholine, and a supplement called B-. This is from Seeking Health. I use that to lay a baseline of nutrition. These are B vitamins without the methylated B vitamins, because some people are sensitive to methylated B vitamins. If you're not laying a good foundation, then you take the methylated B vitamins, you may need more of the methylated B vitamins to have the same effect. So, like I said, if you're magnesium or B2, B3 deficient, your MTHFR enzyme is not going to function as well. So, lay a baseline of nutrition, doing a hair mineral analysis test to check out specifically how your minerals are doing can be really important. If you're taking a multi-mineral and you're copper toxic already and have copper in the mineral, then that's probably not doing you much good, right? So getting specific with your minerals, doing a hair mineral analysis test, they're pretty cheap. So running those can help get you more specific. Pretty much everyone is magnesium deficient. So different forms of magnesium that don't cause as much diarrhea as like magnesium citrate and oxide does, because those are gut stimulatory. Magnesium malate is pretty good. Magnesium glycinate is pretty good. There's a supplement called Remag. The magnesium that's super small, so it can get inside the cells really easily and doesn't have that diarrhea type effect if you take a lot of it. So that can help you remineralize your magnesium. Really awesome. So it's from RNAreset.com is where that Remag is from. Tastes not that great, but you can mix it with juice or water or something like that and hide the taste a little bit. But it's a really good supplement. Just kind of learned about it, so we're using it with our family first. With all the supplements I recommend, most of them we've used in the family, or my family, for a while. So we know that they actually work. We know what's in them. We know how they work. We know how they taste. And how they affect our bodies. So phosphatidylcholine is awesome, helps my brain actually work, which is cool. It needs to do that sometimes, and helps a lot of patients. So it stimulates the BHMT pathway a lot of the times and helps with PEMT mutations. But that's a good one. That's another source of fats. So you want a lot of fats in your diet. Fish oil and phosphatidylcholine gives you the phospholipids with the choline, which is important for brain function. Your vegetable-based fats and stuff like that, olive oil and avocados and things like that are important. And then the B-, like I mentioned. Then after we laid the foundation of nutrition, we look at your methylated vitamins. So taking different forms of the methylated vitamin can affect you differently. So if you have a 1298 versus a 677, then you may need more folinic acid than MTHF. So, it can affect you differently. So you need to play with it a little bit. You may need to combine a couple of these a little bit differently when you're supplementing to make you feel better. You want to do the B9 in combination with B12, so you don't get what's called methyl trapping. And there are different forms of B12. So most people don't know that there are different forms of B12. There's methyl B12, there's adeno B12, and there's hydroxyl B12. Methyl B12 does better with people with just the MTR or MTRR mutations. The adenocobalamin typically will do better with people with a lot of mitochondrial mutations, and the hydroxycobalamin does a little bit better with people, from my experience, with the CBS mutation, but specifically also the COMT mutation. And then looking at other supplements for gut health or adrenal support or detoxification. And oils, you can use oils all throughout this process to boost overall health systems. So this is what one of the reports looks like. This is my report. So, this is not a full report, obviously. So this is the first couple of enzymes. I have a BHMT problem, so I need some phosphatidylcholine. So when I take phosphatidylcholine and zinc, it really boosts me up. I feel awesome on that. These mutations up here, the ACE mutations, AGT mutations, do more with kidneys. So I need some minerals. Typically with that, CBS mutations, I have some of that. So B6 is important for me. Ironically, I don't have MTHFR. So I'm diabetic and I have a lot of health problems, but I don't have an MTHFR mutation. So, like I said in the beginning, you can have a lot of mutations, have other health problems, and not have an MTHFR problem. So, I don't have MTHFR, but inflammation, poor diet, poor lifestyle, younger in life, has led to me being autoimmune and hurting a lot of the time because my liver doesn't function that great and my gallbladder doesn't function that great. So, you know, I have to do a lot of different things, different detoxes, different supplements, you know, things like that. So, a lot of people come to me. I see a lot of pregnant moms. So, a lot of couples that want to get pregnant, but that's certainly not my main client. I mean, that's part of my main clientele, but I have others who are past that age. So, but a big question I get is, what should I do? How do I, you know, help my fertility? How do I help myself during pregnancy? What can I give myself that's going to help me and my baby? And the big thing I say is start everything before you even want to get pregnant, right? So if you're saving up money to wait to get pregnant and things like that, you should be working on your health at the same time. So work on your health at least 6 months to a year before you actually want to get pregnant. Do the lifestyle things, the diet things, make sure you're exercising regularly, you're detoxing yourself, and then do a genetic profile. Make sure you're doing other testing, hair mineral analysis and things like that, to look at your overall health to make sure you're taking the right vitamins and you're on the right path. Take the appropriate supplements before and during your pregnancy. A lot of people, a lot of your doctors, when you go to the OB or some of your midwives or something like that, will just say, oh, you need folic acid. Take folic acid. Well, that's the last thing you need when you're pregnant. You need folate when you're pregnant, or methylated folate, not folic acid. So tell them that. Continue doing all of these supplements and the dietary things and everything while you're breastfeeding. You're still growing a human by yourself. You're just breastfeeding the human instead of feeding them through the umbilical cord. So it's really important, and I see it all the time where moms are like, I had the baby, I can stop all this stuff, oh my gosh, thank goodness, I can stop all my supplements, I don't have to eat well, and yada yada yada. I'm like, you're still growing a human and you're exclusively breastfeeding him, right? Yeah, well, you're still growing that human by yourself. You probably shouldn't be eating the junk and still not taking supplements and things like that, but it feels like this huge weight off their shoulders, like, I had the baby, I don't have to do anything else, I can eat whatever I want, and it's kind of a transition point where I see mom's health start to go downhill because they stop taking their supplements, or they stop really being close with their diet and following that the way they should and things like that. So continue while you breastfeed. So general supplements that I recommend during pregnancy, again, this is general stuff. This may not be right for everyone, but I give this to people because I have a lot of people who are taking nothing. And so they say, what should I take? I said, this is what I recommend, but of course adapt that to what you need and how you're feeling. Prenatals, again, I have a couple of stars here. This is a form that I hand out. A couple of stars here at the bottom of my form that I have. I talk about folic acid and how it's not good, and you need to be taking folate or methylated folate and yada yada yada. So the brand that I typically have in the office is Seeking Health. There's a lot of good brands out there. That's just the one that I do. That brand, typically, some of them don't have iron in them, in the Seeking Health, so if you need to take iron, but some people are toxic in iron, so they don't necessarily need iron. So that's, if you need it, take it, absolutely. Fish oil, definitely important with the DHA especially. Typically I'll use the Innate Choice brand. There's lots of good brands out there. The Innate Choice has a little bit extra vitamin D in there. So typically I'm finding that people have a lot of mutations in their vitamin D enzymes or receptors that actually pushes their vitamin D to more of an active form of vitamin D, so they don't need as much vitamin D as they actually think they do. So vitamin D testing is really important. It's one thing I mentioned in the last time I did this. When you're testing vitamin D, you want to test the active and the inactive forms of vitamin D, because if you're looking at your genetics, you can actually push more inactive to active vitamin D, especially if you're more autoimmune, if you have more thyroid problems, if you have more inflammation and things like that. You're pushing more of the vitamin D from the inactive storage form to the active form. So I see a lot of people in here who have lab low vitamin D storage, and they actually have lab high vitamin D active. So like right now is not the best time to be high dosing on your vitamin D. When they stabilize themselves, your inflammation levels drop, we kind of fix whatever mineral imbalance there may be, and the vitamin D ratio switches back again to where it's more normal, then we can start adding in more vitamin D instead of pushing you way high in the active form, which can aggravate autoimmune conditions and aggravate things like Lyme and things like that. So look at your vitamin D. Phosphatidylcholine, this will help prevent the mommy brain stuff. So anyone who can't think when they're pregnant, or can't think afterwards and things like that, this can help. Choline is really important in brain function, so I've had moms tell me, hey, I can actually think on this. This is pretty cool. All right, so Seeking Health has a supplement called Optimal PC. It's phosphatidylcholine. Probiotics to support good gut health. Innate Choice is where I get that. There's plenty of good ones out there. Ninja Red, this is a Young Living drink. It has blueberries and other antioxidant-rich ingredients in it, so it can support antioxidant production in your body. It also has citrus oils in there. Citrus oils have D-limonene in them, so you can look that up and see what D-limonene does for your body. It does some good things. And liposomal vitamin C. So either liposomal vitamin C or whole food complex vitamin C. So just taking ascorbic acid can actually switch your copper and zinc balances and deplete some zinc a little bit and leave you with free copper that's a little bit toxic to your system, and it decreases your ceruloplasm. It gets complex, but it can mess with copper levels and stuff like that. So liposomal, you don't have to take as much because it gets into the cells, because it's a fat base that gets right into the cells, so you don't have to take as much of it. The whole food vitamin C has the whole complex, so it actually increases the ceruloplasm and helps the copper balance situation. So copper toxicity with pregnancy is pretty common. Copper toxicity can be a contributing factor to postpartum depression and feeling crazy with the hormones and stuff afterwards. It can also be a contributing factor to things like PCOS and hormone imbalance before and after pregnancy. So vitamin C is very important for cellular integrity, the cell structure and things like that. So it decreases stretch marks and tearing and things like that. Some studies show that it helps with labor times and pain during labor and things like that. So and it'll help boost your immune system. So my general list of supplements, obviously do what's best for you. So I talked your ear off and probably said a lot of words you didn't understand. Hopefully I didn't go too far over your head. I tried to keep it a little bit basic and add in some stuff to intrigue you to go further. And here's where to go further. Dr. Ben Lynch does a lot of good work. He used to be a practitioner, but he likes research, so he stopped doing that, and all he does is genetic research, so he's awesome. A lot of what he says is really great. MTHFR.net is his website. Seeking Health is actually his company, and he puts the correct one of the correct vitamins in his supplements. So I like his stuff. Sterling Hill, Jess Armine, Sean Bean do a lot of great work. They're with the Institute for Methylation and Bioindividualized Medicine. And on their website, they have a lot of practitioners that you can go to if you're in different areas of the country, Periscope users. You can go to their website and check out different practitioners that you can go to. Sterling Hill does a lot of work with the genetic part of it, and she does a lot of work with the MTHFR support. Amy Yasko does a lot of work with autism and trying to reverse some of the autism stuff with kids. Her protocols are longer and typically a little more expensive, but she sees really good results. So what she's doing and her information and what you want to go look up and read about her, she does some really good stuff. So she's a biochemist and she's brilliant. So I read a lot of her stuff. And then that's my info. I do, for the Periscope people who are far away, I do phone consults. If you want to talk to me about anything, feel free. Give us a call, give us an email. Email is probably better, actually, to contact us by, but you can call us too, anytime. If anyone here has any questions, you can ask now or afterwards or anything. So Periscope people, if you have questions, go. Any more questions here? Yeah.
So is it better to run your genetic background before you do anything? Like, is that better to just say, I'm just going to run this?
Sure. I mean, it never hurts to run it. It's not going to change. So
Right.
if you got the money for it right now, go for it. I don't base any of my treatments specifically off of the genetic test. With patients, I always explain to them, these are the enzymes that you have mutated, or the genes that you have mutated. This may affect this enzyme in this way, so this is what you look out for symptom-wise, and these are things that support the enzyme function. So if you're deficient in certain things, that may affect these functions, and that may change how you're feeling. And then we look at the mineral balances, we look at blood work if they brought that in, or we test them for things like vitamin D or thyroid function and things like that. So we look at a lot of different things to try to put everything together in combination with the genetics. So I never want to treat anyone specifically off of their genetic codes by themselves. So yeah, but anytime, yeah, sooner the better, I guess.
And they're not super expensive tests.
No.
You flip that light on too.
Yeah.
It's really dark. That's better.
Yeah, they're not expensive. The 23andMe is $99, and then I think the Sterling app is $20, and Live Well is $20 as well. And Sterling Hill, like if you can't afford some stuff, I think they work with you or can work with you. I don't know. You got to contact them to see if you really can't afford their test, but it's super cheap compared to other blood work and stuff you can have run. So $119, not bad. Yeah.
2 questions.
Sure.
Do you have a company you recommend for the hair analysis?
Yeah, there's a couple. Trace Elements does a good job. And I have some of their kits here if you want them. Not right now. They're coming. There's another one that I'm blanking. Starts with an A. I don't know. Periscope users, you're probably following Jim Bob Haggerton. He runs the other one. It starts with an A, but he can tell you. Basically, with the hair mineral analysis, you want to find a company that doesn't wash the hair in things like formaldehyde and things like that. So Trace Elements does it, and that other lab that Jim Bob uses doesn't wash it. So if any of you on Periscope know, go ahead and shout it out. I'm blanking on it right now. It's kind of late.
I have one more.
Yeah, go for it.
If I've already run my genetic data through LiveWell, is there any benefit to using Sterling's app?
I'm sure there is. I mean, Sterling's app, I think, does. I haven't seen one in a while. They've been upgrading their profile, so there may be more information on there. They've been upgrading it, so there may be. Yeah. I mean, if you haven't done it yet, I would just use Sterling's because it probably gives you more info, to be honest. Periscope doesn't have any questions? Come on. What's up? Probably will watch it later. Put my kids to bed.
There were a lot of people on, and then they jumped off.
Yeah. Cool. How was that? Was that super far over everyone's head? Try to make it simple. It's really complex, though. I mean, it gets complex. So try to keep it simple.
Sorry.
You need methyl groups.
Is that is that something you do while you're healthy or while you're sick? That's what I like.
I mean, you do it while
I'm
you're...
pretty healthy now. Should I do it and see what's wrong?
Yeah, you
Or
might as
maybe
well.
or
Yeah.
something? I don't know.
I mean, you might as well do it now while you're healthy so that you can prevent stuff, or that if stuff comes up, you're
Right.
like, oh my gosh, I'm feeling this way, or I'm having clotting issues, or something comes up randomly, that you can address it really quickly.
So like with your son, he had that mutation and then he got sick and
he got
that's what
sick.
triggered it, like to come out, I guess?
Yeah,
Is that-
and so if you have an illness, you get mineral depleted, say, oh, I have that mutation, that's probably why I'm feeling this way, I'm probably deficient in whatever the cofactor is, say, okay, let me take some zinc and see, how I feel and see how I get, or whatever, so...
And actually, when you told that story, you didn't tell it totally correctly because we hadn't run his genetics when he was sick. We had run our own genetics.
Oh, that's right.
And you crossed our genetics.
That's right.
And then
our genetics.
it took
Okay.
it took 6 weeks for us to get his back to confirm what you found
right.
through our genetics.
Good thing you have a better memory than I have.
It's phosphatidylcholine.
Yeah.
Right? I haven't taken mine, so. Yes, yeah. So I looked at our genetics. But I was right. So it works.
So to run a genetic, it's just like my mouth swabs. I wouldn't need like mine and my parents, or
No, you just spit in the tube
oh,
and
okay,
send it off.
It's like a tablespoon of saliva. It's
Yeah.
not much.
okay.
It's not much. So.
And they have kids collection kits too.
I don't know that they have the kids collections anymore.
Oh,
To
they
be
used
honest.
to.
I think they stopped with the kids collection kits. So
That's a bummer.
So you would just use the adult.
you would use the adult and do your best, I guess.
You can have a hopper first.
we did it on. We actually did it without the kids collection kit initially on our kids, and
Your son did fine.
he did fine. Josie was little, but we had her chew like on a wooden, like a popsicle stick or something to make her drool,
Yeah.
and just like caught the drool. So, I mean, not like a popsicle stick that had juice on it, like
Yeah.
a plain popsicle stick. Yeah.
Yeah, like a tongue difference.
Yeah, that's what I meant. I don't work in the office anymore.
You said you also do blood work as well, or recommend blood work as well.
Yeah.
Is that something normally insurance would take care of, or because we're doing something out of the quote-unquote mainstream?
Yeah, because we do something out of the mainstream, and typically what I order is more functional panels to
Right.
look at more specific things and look at different ratios between numbers. And if this number's high, then we look at that number functionally to see where your patterns are at, to say you're tending in this direction, and this is what you need to do to kind of correct it. I run way more stuff than normal people run, so it's typically not going to be covered by the insurance. If you run it through the insurance, it's going to be way more expensive than what you pay here, because I can get a deal through my lab.
That was my
So,
next question. How that looks
Yeah,
financially.
so we
Okay.
get better cash deals
Right.
with the lab through my system that I have here, and a lot of practitioners have that. So,
Good.
especially the functional medicine docs, they know they need systems to run more complete blood panels instead of running TSH for your thyroid. You can actually run a complete thyroid panel that looks at all of the thyroid numbers that you need to actually look at to diagnose something, and but that costs $700 when you run it through insurance, and it costs, I don't know, what, $80 or something when I have it. So
Okay.
it's a little bit
Awesome.
different. So yeah.
Good to know. Thank you.
Yeah.
And one other one. This
Sure.
might be silly. I kind of feel like I should know this. Your DNA and your RNA, if you have mutations, are those mutations going to be there throughout your life, or are they going to change based on?
Yeah, so they'll be there.
Okay.
Typically they'll be there, right?
Right.
So your genetics don't really change. It's the expression of the genetics that changes. So your epigenetic expression. So if you're way toxic, if you don't have vitamins and minerals that you need, you're going to express more inflammatory genes. You're going to express more of the mutations and things like that. But if you are using more essential oils and you're detoxing and you're not deficient in your vitamins and minerals and things like that, and your inflammation levels are low, you're not going to express the inflammatory genes. You'll express more of the healthier genes and things like that. So it won't show up as much or at all.
So
Just
you
because
need
you
to-
have the mutation doesn't mean it expresses itself.
Right.
But just because you don't have the mutation doesn't mean that it is not going to be a problem. So that's why looking at the genetic panel is kind of I don't know. It's kind of revealing stuff to you that may be, but it may also not be. So it gives us a little bit of a window into your function, but it doesn't tell us everything. So just running that is not the end-all, be-all. And that's what a lot of practitioners latched onto first. They're like, we can run the genetics and then give them a supplement for that one, and a supplement for that one, and a supplement for that one, and you're on like 15 supplements because you have 45 mutations, and it just doesn't work that way. So you got to look at what's expressing and how the function is in the body to what you actually need to support the body, and then you can say that's what's happening. That enzyme is expressing itself because this mineral is deficient.
So it helps to have it, but you don't have to redo it like every other year.
No, it's not. No.
Yeah, it's
no,
just
yeah. And even like twins, it's not like you run one and then you have both their genetics. They'll be different. They'll have different genetic codes. Like my brother has different genetics than I do, or different mutations than I do.
They're twins. He didn't
We
say
are
that
twins.
part. They're
So
Identical
we're
twins.
We're identical
Yep.
twins.
Right.
So my brother has different mutations than I do. Or will have different. So yeah, so it's not always the same.
So the report from Sterling, when you run it through that, what does it give you? Is that what the red
Gives you that.
Okay.
And then we would
Green is
bring it
good.
to you.
Yellow is
That
maybe.
would be like what
Red
then?
is bad. What's that?
And then we bring that to you.
Yeah, because you can't read this. You don't know
Right.
what
I'm
this means.
like, I don't know that.
I know what that means, but you don't know what it means. So, yeah, I look at that, and that's the gene that codes for a specific enzyme that does a certain thing, and these are the alleles and stuff like that. That you know, you don't need to know all that. That's why you bring it to me, and you bring it to a practitioner that knows more about this stuff and is super nerdy and looks that stuff up. So, me.
So say you've had like blood work done and you
Yeah.
would know that you're deficient in something, like just random yearly blood work, and they're like,
Okay.
oh, you're deficient in vitamin D or whatever.
Yeah.
Then is it better to look at your, because I know you were talking about vitamin D.
Yeah, so typically when you get your yearly blood panel, they'll run the inactive vitamin D and nothing else as far as vitamin D goes. So that's why I say when you're talking to them and they want to run vitamin D, tell them to run both, the 125 OH and the 25 OH, so that we have a ratio between the two. So typically they're not going to run the ratio. Typically people are going to be low in the inactive form. And that's why people supplement with like 10,000 units a day of vitamin D, which which I used to do. I mean, I used to supplement people all the time with a ton of vitamin D. I'm like, this is really essential that you need. And then I learned more about the genetics and the receptors and how the vitamin D gets moved from active to inactive to different forms, and it may not be as crucial to take it when your active is super high. It may actually be detrimental, especially with like Lyme patients and things like that. So, yeah.
In that instance, what would it do? If it's crucial, I mean, what if your D is low and they only run the one,
Mm-hmm.
and they say take a bazillion and you do, and you feel lousy and you're doing what?
Well, maybe aggravating the autoimmunity, and maybe you're getting a toxic load of vitamin D, especially active vitamin D, which turns on more immune function and things like that. So if you already have an autoimmune condition and things like that, it could be making it worse. It could be clogging different receptors. And
I think I'm there.
Good.
So getting this
Mhm.
before anything happens instead of having to wait 6 weeks, because it does take a while.
Yeah, it takes a
Getting
little.
this-
I mean, we got ours in like 3. Just I guess they weren't busy that time. So I mean, but they say it may take 4 to 6 weeks or whatever. Yeah.
So just having this in place
Yeah.
so that when you do the lab work, which they're not going to run,
Who's on
your regular
the
doctor.
people?
Yeah, the people, they're not.
Then.
You and I, a year and a half ago, I fought tooth and nail for
Yeah, they don't.
the
run it.
thyroid stuff.
Yeah, they
you
don't
and
run
I.
it, yeah.
And she finally conceded, but
Right.
you know.
Yeah, they don't run it. So.
Anyway, so doing that, and then that helps if my D would be low, what to do as opposed to just go grab a bottle of something. It would be based on, if I came to you with the labs and you had this in place in the file already.
Yeah, I'd run
And
the
we-
other vitamin D on you.
Well,
Yeah.
Yeah.
I mean, that would
Yeah.
show me, like,
Right.
I don't know where
Right.
this is. It says VDR BSM is one of the mutations that increases the push from inactive to active. And so some of those mutations, I'll say, vitamin D is super high over here. You either have immune problems, inflammation, or that enzyme is function. I mean, you're showing symptoms of that enzyme misfunctioning. So,
Okay.
so it gives us a better picture of, well, that's why you have overactive stuff. You may not need to be taking as high vitamin D. We need to do other stuff with minerals, like magnesium is super essential with vitamin D.
Instead of just the knee-jerk
Metabolism
reaction
and utilization.
of
So,
increase the D.
yeah, and it typically is a magnesium deficiency to where you're not metabolizing or utilizing the vitamin D in the appropriate ways. So you have toxic calcium, biounavailable calcium, and biounavailable magnesium, and things like that, to where you're actually deficient, but you have high unavailable levels in your system. So your vitamin D doesn't know what to do, so it pushes active. So it gets complicated, but yeah.
So do you do yearly blood work for people?
Yeah, if they want it. I just did some for.
Like
Couple
instead of
patients.
going to your doctor?
Yeah, if you want to.
Do you run it all, or do you just kind of?
Yeah, I'll run the full panel. I mean, if you don't want certain things, I can. take it
know
off,
what
but-
to be like. No, I don't want that.
I'll tell you what's on my general panel that I run on people and look at different function. And some of the blood work I ran for a few patients a while ago looked really good. And there were a couple minor things that I said, hey, you may need to do a little bit of this, you may need to do a little bit of that. Overall, you're tending a little bit towards this way, but you're doing great. I mean, everything's within normal lab ranges. If you went to your normal doctor, they'd say, see you next year, and not do anything to you. So, yeah. Yeah. Voice is fading. Okay. Cool. Got any more questions or want me to go over anything like this again? It's really not super essential, but the big picture is you need methyl groups, you need other vitamins, and that's kind of where MTHFR fits in. It's at the beginning of that cycle. So that's why it's such a big deal, is because you can't even start the cycle if you have a problem there. So there can be a lot of other issues, but that's the beginning of the cycle. So people focus on that. There's a ton of research on that one specific enzyme, so a lot of people focus on that because that's where a lot of the research is going these days. So there's not a whole lot of research on MTHFD1, but people focus on MTHFR, and typically a third of the population has a heterozygous mutation. More common in Italians and Hispanics and Asians, but a lot of research goes there. A lot of health problems can stem from that not functioning well. So, so methyl group. Who knew that high school chemistry was coming in?
None of that.
Thanks, Periscope.